so so if I have a virus right now, everybody has something going on in them at one point. But so let's say I have viruses in here. How is it? And help me understand this. How is this killing those bad bugs? Or if there's cancer cells in me right now, how is it killing those cells? Is it just making my immune system fight those better? Or is it the ozone, the oxygen that kills those things because those diseases don't like oxygen?
Yes, cancer grows typically in an oxygen-poor environment. That's what helps cancer cells to grow. So when you saturate the body with oxygen like that, that's one reason. That can slow down the growth of cancer. That won't necessarily kill the cancer cells, but that can suppress them from rapidly dividing and rapidly growing. So that's one component. The second component would be the boost that you get to your immune system. So on the one hand, you're suppressing the growth of the bacteria, the virus, or the cancer cell, and then simultaneously, while you're suppressing it, you're also boosting your immune system to come in and attack it. So you're hitting those organisms and cells from two different components simultaneously. And you're not poisoning your body while you're doing it, which a lot of chemotherapeutic drugs and pharmaceuticals, even antibiotics, do, is they actually suppress your immune system. All the drugs that are used for autoimmune, suppresses your immune system. A lot of people who have been on chronic immunosuppressive treatment for an autoimmune disease, they often get another illness later down the road. I know a man, he was a good friend of mine, he had a kidney transplant, and they kept him on an autoimmune suppression course. They had to, because otherwise his body would have rejected the kidney. What do you think he ended up dying of? He had cancer, because he had no immune system to fight the cancer off. This would have been great for him. This would have been great for him.
So is this one of those things, because look, I mean, everybody, no matter what profession you're in, you get excited about something, right? And you end up telling all your buddies about it or whatever. Do you find yourself doing that? Like telling your circle of friends, like, you got to do this?
Well, I talk about ozone all the time.
All the time.
All the time. Because I hear a lot of my friends will talk to me and they'll be complaining of something, and I say, let's give you some ozone. We'll usually get you better. I'll give you a great story. I have a girlfriend who's a doctor, and she runs an urgent care clinic, and she's really good. She's really smart. She's been an ER doctor for 30 years, and she knows everything. And she's phenomenal. She's really a top doctor. And she gets the worst bronchitis I've ever seen. And it takes her out, and she usually gets it twice a winter. And she is so sick. And she typically goes on steroids, antibiotics, all the inhalers, and she suffers and suffers.
So this has been going on for many, many years.
Years and years.
A couple times a year.
Yeah. So I first started dating her. She comes down with one of these bronchitis episodes, and I say to her, you got to come to my office. I'm going to give you ozone. Get rid of it. She poo-pooed it. She goes, are you kidding? She goes, I would never do that. She's so traditional. She's like straight arrow traditional. Okay, this goes on, it goes on.
So she didn't accept it at first. She probably told all of her friends, dating this new guy, and he's into this ozone. I think he's crazy.
She wouldn't even tell her friends. She wouldn't even tell her friends. She wouldn't talk about this. She thought it was just insane that I was doing this. Anyway, to make a long story short, we've been dating for years now. This bronchitis thing happens twice a year. Finally, I convinced her to come in. I gave her a treatment. Lo and behold, the next day, she's better. Normally, she's sick for 6 weeks.
Yeah.
Clearly, 6 weeks sick. So I say to her, well, what do you think of your ozone treatment? So she's very skeptical. She goes, well, there might be something to it. There might be something to it.
Because you got it early on, right when it started, her bronchitis.
Exactly.
So then she was thinking, well, maybe it wasn't bronchitis.
But she's never gotten rid of it before. It's never stopped. Once it starts, it's a progressive downhill course.
So she hasn't gotten it?
Anyway, I've done this now 3 or 4 times. I catch it early, and I stop it dead in its tracks. Now, she gets bronchitis. She calls me up. She says, can I come in for an ozone treatment? I'm the first person she calls when she starts to get sick.